Welcome, friends and warriors, to Power Over Pink, where we share stories of warriors who have walked the battle of breast cancer in hopes of encouraging you and helping equip you for your own battle as you walk ahead onto the field. Today, I would like to share with you my story. When I was younger, I did do a long stint at birth control. And then when I decided to start a family, I had a very hard time getting pregnant. It took almost a year to get pregnant, and I, wondered if my hormones were imbalanced because I had, symptoms of heavy periods and such all through that time once I came off birth control. Thankfully, I was able to get pregnant with my son, who will be turning 18 in a few weeks, and I noticed very quickly after I had him, within a week or two, I got very emotional and was not myself, and I thought maybe I was suffering from some postpartum. At the time, my husband, who is a pharmacist, was learning all about bioidentical hormones and was going to be working in a local compounding pharmacy. And on the 8th day, when I could not stop crying, thankfully he contacted his friend and they decided that I needed to be on a large dose of progesterone cream. So with our bodies, progesterone is what helps us carry the baby and keep the baby alive. And so when you have the baby, that plummets to nothing. And so a lot of times the symptoms we have from postpartum can just be a plummet in progesterone. So that started my journey on my hormonal imbalance then. And I had him when I was 25. And so it was an early start to this, and I thought I was too young to have to face a lot of the things I was facing. I was told I was perimenopausal, and I stayed on the progesterone cream for about 6 years. And then I found a cyst in my breast on my right side somewhere along that journey, and I started getting breast imaging then. And then after 5 years of doing that, they no longer were concerned with the cyst, but then they had found some calcifications. I got a biopsy, and the calcifications came back as precancer, and they suggested, but it was not, really pressed, that I speak to an oncologist. So I decided not to because I was young. I don't have cancer. Thankfully, they found it early. No big deal. I'm going to move on. I didn't want to be a burden to my family. But what I did was I decided in that moment to cold turkey stop doing the progesterone cream that I was doing because in my mind, it had to be what caused the precancer. And so I stopped the hormone stuff, and I kind of felt good. I didn't feel crazy. I didn't have a lot of symptoms that came from that. So I thought, well, maybe I didn't need it anymore. But hindsight, now I know that I wish I had dove deep into why my body was so imbalanced and why I had so much extra estrogen and why was my body not making the progesterone. But I didn't. I just moved on with my life and hoped everything would be fine and no big deal. Well, then I was about 6 years out from that, and I ended up having some calcifications come back. And so I went for my yearly checkup. I was not quite feeling good. I was seeing a local holistic doctor, and I was trying to find out, why is my energy so bad? I just don't feel good. About a year and a half prior to my breast cancer diagnosis, I had an appendicitis where my appendix had a tumor or a blockage and it ruptured. So for 3 days I had massive bacteria going through my intestines, and I had to stay in the hospital for 3 days on IV antibiotics. And then, it saved my life. If I had not had praying friends at the time, I would have gone home and I would have died. But thankfully, God is good and I'm still here. But after that surgery, I just didn't feel like myself, and so I was trying to rebuild my GI system because the antibiotics really wrecked me, and I was afraid of scar tissue and all these things. So I was seeking this new doctor, and then she did notice that my white blood cell count was high, so she was going to do these white blood cell tracer tests and just kind of figure out what was going on. But then she was like, "Oh, are you also due for anything else?" And I was like, "Yes, I'm due for my annual mammogram, and I'm actually a little late." And so she sent me to get my mammogram. Thankfully, I had been getting the same images for over 10 years at the local hospital, so I went back and we had a big family issue going on that we were fighting, and I was actually on the phone with it was a really stressful phone call that I was a part of, but the hospital called while I was on the phone, but I went ahead and answered it, and the nurse that I had known for 10 years was like, "Hey, Miss Cam, your calcifications are back, so the doctor would like for you to get a diagnostic and ultrasound again." And I said, "Okay, no big deal. I've done this before." But in that moment, something in me switched, and I hung up the phone from the stressful phone call I was on, and I told my husband what she had said, and I cried. I cried very hard, and I thought, oh no, do I have breast cancer? Our mind goes to the worst possible place, of course. But then I'm a dental hygienist, and I love all my patients, and I started thinking, all the women I had been seeing in my chair that were also breast cancer survivors, and how, it was kind of odd that there had been so many. I mean, I'm talking over 20. And so I thought, man, what if God had put those women in my chair to prepare me for my own battle? And I, kind of thought, well, that's a crazy thought, whatever. But then I was going to have to schedule my diagnostic if they didn't have any openings, and I wanted to get it done as fast as I could. And so I ended up scheduling it on a day that I was supposed to work. So what I did was I went in and saw a patient, and then I was going to leave because the hospital was nearby, and then I was going to go back to work after. And so when I got to work that morning and I saw this one patient who was also a breast cancer warrior on my schedule, I stopped in my tracks and I wept. And I'm not a crier. I'm not a big crier. I mean, usually I just cry when I'm mad, but this was different. And so I had to suck it up and be professional. So she came in and, we did her cleaning and talked about life and caught up. And then at the end of her appointment, I said, "Hey, I just have to let you know where I'm heading after you leave. And I do find it very odd that you're here on the day that I'm going to get my diagnostic." And she said, "Well, first off, I'm not a bad omen. And second off, I don't think you have breast cancer, but if you do, I will be with you and I will walk with you through this." And so I left a little encouraged. And so I went in that morning to get the imaging. And I knew in my heart that I needed to hear from the mouth of the radiologist. And so I specifically asked if I could speak to the person who was going to be reviewing, and they said, of course. And so I did the mammogram. They took me downstairs to do the ultrasound. And the hospital, I don't know if they were just out of gowns or what, but this particular day, and I've done many, they gave me a very small washcloth to cover my chest up with. And, no big deal. I've had a couple kids. It's not a big deal. But I was laying on the table, and the technician was doing my ultrasound, and the doctor walks in, and I'm laying down, uncovered. And so I, covered myself up, and I was like, oh my gosh, why is he in here? And he was very abrupt and abrasive, and he was like, "Oh, you wanted to see me?" And I was like, "Oh, yes, I did, but not like this." And so you could tell he was kind of rushed and not really wanting to be in there. So I was like, "Yeah, I just, wanted to clarify with you because I've had these calcifications before and they're back, and, should I be worried about this?" And he was like, No, you're fine. It's nothing. Don't worry about it." And I was like, "Oh, okay." But then, inside I was like, that doesn't feel right, whatever. So he leaves the room. The technician left with him. So I was like, oh, I guess I'm done. And so I get up and I get dressed because I've got to hurry back to work anyway. Well, he comes back in the room and the technician is following him, and he was like, "Oh, we're not done yet. She needs to show me something." And I was like, "Well, I already got dressed." And he was like, "That's fine. Just lift up your shirt." And I was like, oh my goodness, this guy, so I was like, okay. So I lift up my shirt, and she's like, "Hey, here's the cyst we've been watching, but what is that?" And he, didn't even look at the image, and he's like, "It's nothing. She's fine." And so I was like, "Hey, well, while you're in here, let me clarify. I haven't had any calcifications, and now I do. So you're telling me I don't have to worry? And he was like, yeah, it's just residual from your biopsy. And I said, well, yes, I did have a biopsy. I said, but when it came back as precancer, I had surgery to remove it. And that was really when I found out that I had the precancer. And he was like, yeah, it's fine. It's nothing. How old are you? And I was like, 42. And he's like, yeah, you're too young. It's fine. Don't worry about it. He's like, I'm going to go get your paperwork to release you. And so I was like, okay. So he leaves, and everything inside of me responded. I wanted to throw up. I wanted to cry. I wanted to scream. I was like, man, I really don't like this guy. He's really abrasive. Is that why I'm feeling so strongly in this moment? And then I was like, nah, I don't know. I just really feel like there's something there. And so I just stopped and I prayed. And I was like, God, I don't know why I feel so strongly against this man. I know that a lot is happening right now. I don't know if there's something going on, but if there is, God, make him see it. And I was like, just make him see it. I don't want there to be cancer, but if there is, make him see it. And I knew that he wasn't seeing it. And so he comes back in the room and had already signed my release form. And so he sends me the paper, and he was like, here, go ahead and sign here. And I said, hey, just one more time. Like, you're sure that it's nothing, because it's been clear for 6 years and now it's not. And he's like, yeah, it's fine. I'll see you next year. And I was like, okay. Meanwhile, I continued to pray because I wanted to vomit. Everything in me was responding in a way that I had not really experienced before. And I know I'm a big personality, and I know that a lot of people aren't, and I know a lot of people wouldn't have pushed in that moment like I did. But y'all, everything in me was responding, and I had to listen to that. And so he leaves. I'm in a hurry to get back to work, and so the technician and I start laughing about how wonderful he was and how it must be so great to work for him. And she tells me he's like that all the time. And I was like, well, I'm so sorry you have to work with people like that. That's too much. That's just too much. So she is walking me out, and there's these double doors in this long hallway, and I hear someone running behind me. And so, of course, I've watched enough TV to know I should look to see if I should run too, or just get out the way. So I turn around, and I see him running from his office with both hands up, and he's like, wait, stop, don't leave. It's complicated. So I knew instantly that he had gone back to his office and actually taken the time to maybe look at my chart and actually look at the images. And so they take you to the little scary room where they tell you have, something going on. And the nurse that had called me to make this appointment had already gotten all of my paperwork ready, and she knew there was something. But she was like, why are you still here? I thought he had released you. I was going to lunch. I thought you were, cleared. And she's like, but I was wondering why I didn't hear anything sooner. And so then this man had to sit across from me and tell me, oh, well, there was just so many images, so many images. And I'm thinking in my head, there was five images. They took 5 images. So I don't know what he had come from. I know radiologists have a lot they have to handle, a lot they have to go through, but it was just almost like he was distracted and just wasn't fully engaged. And thank God that God heard my prayer, and that man stopped whatever he was doing and looked and paid attention, because had he not, I probably would have had a much harder battle. And so God is good, and I got a locator placed, and I thought, after going through what I went through with him, didn't even occur to me that I would need to request who the radiologist was he was going to do the locator they place inside your breast. And so I show up, and mind you, all of this is happening during COVID, so I'm having to do all of this by myself pretty much. And it was stressful, but I was like, okay, I'm a big girl, I can handle this. But it was hard. And so my husband drops me off for the appointment to do the locator. I go in, and I'm the first person scheduled that morning. And then this doctor shows up almost an hour late, and he's just messy. His scrubs are all wrinkled, and I realize it's the same man. And I was like, oh no. I didn't even think about asking who it was going to be. And so then I was having to wear a mask because COVID was going on, and the nurse was checking me in, and she couldn't get my oxygen levels to be high enough to make it okay for me to do the procedure. So she's like, just take off your mask. So I took off my mask. And so he comes in to sign the paperwork for me to do the locator. And he looks at me and he's like, I thought he was mad because I wasn't wearing a mask, but he was wearing one. So he looks at me again and he was like, have we met? And I was like, it's only been a week since this guy literally made me so angry, and he has no memory of it. I was like, that's unreal, but okay. And so anyway, he does my locator, but he is having such a hard time getting the numbing needle to go into my breast tissue because it's so dense, and it was like his hand was shaking because he was pressing so hard to get it to go through. And so he ends up telling me in that moment, like, well, it's a good thing you didn't just go do the biopsy, because I had told him, we're not doing a biopsy. That mess hurt too bad. I've done it before. We're just going to do surgery. We're going to get it out. I don't want to play around. And he's like, well, that's really aggressive. And I was like, yeah, it is. But I'm calling the shots. Like, I don't need to do this twice like I did last time. And so we went straight into that. My surgeon agreed. And so anyway, he tells me as he's trying to shove this needle in my breast that he was glad that I decided not to do the biopsy, because where he needed to get to was so deep and the tissue was so dense, he didn't feel like they would have gotten to the depth where they needed to. And so that kind of gave me some relief. And then the whole process of my cancer was the slowest thing I've ever experienced. Like, it was like, okay, you need to go get an imaging, wait 2 weeks. Okay, now you got to go do this, wait 3 weeks. Okay, now you got to go do this, wait 6 weeks. Okay, and it was like, wait and see, wait and see, wait and see, which honestly is one of the hardest parts of the battle, because you think it's going to be fast and like, oh, let's get this done, and it's just not. And so wrap your mind around that. Like, these people are so busy. Unfortunately, it's impossible to get scheduled for some of these surgeries and get things done. So it's just a lot. And so anyway, the day of my surgery comes around where they're going to go in and take out the calcifications that are back. And one of my dear friends who I had not seen in a while is an anesthesiologist, and she came in that morning. And just her presence, she's super strong in her faith. And she asked me, have you already prayed? And I said, yes, but I would love to pray again. So she prays with me, and I just felt God's presence in that space. And the surgeon who was going to be doing my surgery was also the surgeon who had done my pre-calcification 6 years before. And he was also the one who saved my life with my appendicitis. And so I felt really confident in him and his abilities. And I was happy with my team, and I just felt God's presence with me. And so anyway, they go in and they take it out. And when the surgeon came out, he told my husband, everything looks good. I don't think there's anything to worry about. Clean margins. We got everything, it's fine. So in my appointment and waiting to hear my results from my surgery was almost 3 weeks. And so I was under the impression that if it was cancerous, then they would call me and get me in sooner, because why would they let me wait 3 weeks, all this stuff. And so in my town, our main bridge that goes from where I live to Pensacola, the bridge was wiped out from a hurricane. We were getting a new bridge, and the hurricane wiped it out, so they're having to literally rebuild the bridge. And so most of the time, our commute from our home to town was, pretty short, 25 minutes. And now that the bridge is out, literally everybody from one town is having to go this long commute on the interstate to get around. And it's just, it was a mess. It was over a year of just insanity. Well, so my husband was working in town. I was going to get my results. I felt very calm about it all, so I was like, I don't think it's anything. My husband was like, do you want me to come to your appointment? And I said, no, I think they would have called me in sooner. It's a long drive home. Just go get some food started. I was the last appointment of the day. I think my appointment was at either 4 or 4:30. And I said, he's probably going to be backed up because it's the end of the day. And so sure enough, I get to the office, and there's a wait room full of people. I'm the last one on the list. And so I was there for probably an hour, and then they come get me and take me back to my appointment, and they sit me down, and I'm waiting for my good news and thinking I'm going to be getting out of there. And the surgeon looks at me and says, you have breast cancer. And I was like, no, what? No, I don't. Sure, I don't. And he was like, you have breast cancer. And he said it's pretty early in its stages, probably stage 1. And he said, but it's grade 3, which is the most likely to metastasize, and so it's aggressive. And you had lobular features, and so I honestly, I did not hear anything else from that point forward. And I got tunnel vision, and I was like, this can't be. I mean, wouldn't it just be precancerous like it was before if it was the same calcifications? And I was confused and scared, and I thought, oh my God, why did he just tell me I had cancer when I was by myself? Now I have to drive home in this insanity by myself. And I was just amazed that that would even be part of the journey. I mean, I was honest to goodness, I thought, why would they not have called me and told me to get my husband to be with me for this appointment? And this can't be how this is. And then the reality, like you hear the word cancer, and I don't care if it's pre-cancer, if it's a possibility of cancer, if it's just the thought of cancer. When you hear that word, it is terrifying. And so to hear that word, you have cancer, and then have to muster up your strength and leave and get in your car and drive home, I still can't believe that was acceptable, and it still happens today. So if that's you and you were told you had cancer by yourself, I am so sorry that you experienced that. That should never be the case. Like, the medical professionals should do better. I don't know what the solution is. Maybe call me at home and tell me my results instead. Like, maybe make sure you call and say, hey, make sure you have someone at your appointment. We're going to be going over some details. I don't know what the solution is, but it should never, ever happen. And so I pour myself into my car. I sit there for a good hot long while trying to calm myself down and catch my breath. And I drive myself home, and I'm having to drive in this insanity of traffic that we don't normally have on the interstate home. And I'm thinking, God, just get me home. I don't want to die trying to get home because I'm scared because I have breast cancer. So then you get home, and then you have to tell your family that you have cancer by yourself. You have to be the one to say it. Oh, it's making me emotional. And it's been 2 years, but can you imagine me having to tell my husband that I have cancer? It's just not right. And so I tell him what the doctor said, and he has a million questions. And of course, I don't have any answers because I didn't hear anything that the doctor said. I didn't hear anything. And so then I have to tell my kids, my son and my daughter, who are young teenagers at the time, that Mom has cancer. And I didn't really think that I should tell them, but I was emotional and they saw it. And so I didn't hide it from them. We're very close, and so I wanted them to know what I was going through too. But then, hindsight, I kind of probably should have not done that because I scared the hell out of them all. But my next steps was to meet with an oncologist, of course, and to talk about the full diagnosis and what that meant. And so thankfully, because of the shock of finding out by myself, I knew that I couldn't go to these appointments by myself. And so I asked a friend to go with me to these appointments and take notes. And I am so thankful that I did, because honestly, y'all, I had no idea that I have a superhuman power, the ability to hear whatever the heck I want to hear. So at this oncology appointment, I heard what the doctor was saying, but then I didn't hear what the doctor was saying at all. And I thought that I had a choice whether I had to do chemo or not. And I don't know why I walked out of there thinking that I had a choice, that the choice was mine. And then I thought, why would the choice be mine? Why do I have to make that decision? Either I do or I don't. And so then I had to do the lymph node surgery to see if the cancer was in my lymph nodes. And because I was aggressive and getting my calcifications removed first, then that kind of made me have to have 2 surgeries. So then that was kind of silly on my part, but I'm okay with how it all came about. I'm sure it was all part of the plan, but so I get my lymph node dissection done, and everybody was like, oh, lymph node is easy. You'll be back to work by Monday. And I was just thinking, okay, so I'll give myself a long weekend to get this done. And oh my gosh, that lymph node surgery was not easy. To this day, I still cannot feel anything in my armpit. I'm completely numb, which is very common, very normal. And it was intense. It was very hard to heal from that surgery as well. So I had the lumpectomy, and then I had the dissection of the lymph nodes. And then when everything came back that I had cancer in my lymph nodes, that meant I had to also have surgery to have a port placed. So hindsight, I would probably have done, all in one if I could have, instead of, or maybe just 2 surgeries, but that's not how my story went. So I did I did sit down with my oncologist, and again, I really felt like I had the option of not doing chemo, but unfortunately, when it's in your lymph nodes, that kind of changes things. My oncologist told me that based on my genetic testing being negative, but my lymph node being positive, that I had to do chemo and radiation. So my full diagnosis is stage 1B invasive ductal carcinoma with lobular features, which I did not find out till much later that it was lobular, but grade 3, and progesterone and estrogen positive, Her2 negative. And so thankfully my genetic testing was negative because, I have a daughter and a son, and I didn't want to pass this down to them. But I stopped and started really thinking about, what does that mean? How could it be that it's not genetic? Because when I did my own research and my medical history of my family, on my mother's side and my dad's side, every woman had hormonal imbalance, uterine cancer, fibroids. My cousin had passed away a few years prior from a large tumor that had grown to the point that it was inoperable, and they couldn't save her, and she was only, I think, 6 years older than me. So literally at 42 years old, I was the oldest female in my family to not have to still have her uterus and her parts. Now, I had had an ablation. I had hormonal imbalance. That's why I started the progesterone cream after my son, which helped me get pregnant with my daughter. It makes you very fertile. She was a lovely surprise, and I thank God I have her, but she was not planned. So thankfully, because of my youth and because I had this progesterone cream, I was able to have 2 successful births. And I decided at that point, both pregnancies were really hard on me, so I didn't want to have any more kids, so I had my tubes tied. And now I know that that also creates a lot of issues with hormonal imbalances and such. And then I did the progesterone cream for about 6 years after. And so, kind of as I'm learning and as I'm going through everything that I know now, it's amazing that there was not more explanation as far as what the hormones play a role in breast cancer. And so I've kind of done my own research. So I did chemo and radiation. My chemo was Taxotere and Cytoxan. I had to do 4 rounds, and I did 33 rounds of radiation. And it was a tough journey. It really was. And when I was doing my chemo, unfortunately, I don't know if COVID played a part in this or if it was just lack of employees, or I really don't know, but I did not get a chemo class to explain to me what chemo I was taking and the side effects. I was assigned a breast health navigator to my case, which she was nice, but I didn't ever meet her face to face, not once in my entire journey. And she said that I would. And then she was a big help when she thought I was going to wear the cold cap, but then she kind of disappeared after I decided not to because I couldn't afford it. But I did do some research because Taxotere is known to cause neuropathy in your hands and your feet. And as I mentioned before, I'm a dental hygienist, and so losing the sensation in my hands and feet was not an option for me. That is my livelihood. What can I do to keep my hands and my feet? So of course I turned to Dr. Google and I'm like, help, what do I do? Is there any options? And there was literally nothing. There was this one YouTube video that I somehow stumbled upon, and it was this older lady, and she was standing in a parking lot, and she was real loud and funny, and she was like, y'all, I just went to my naturopath doctor, and he was like, get you some L-glutamine, because it's going to help save your and keep you from getting neuropathy. And she's like, so I went and got me some of this and blah blah blah. And I was like, cool, I'm going to get me some L-glutamine. I don't even know what that is. And so I research it, and I'm like, okay, that sounds right. So I go to my local health food store, and I get some of that for $9, and I'm like, I can afford $9. I'm going to take this pill, and hopefully it works. And so I took that, and then the female that I mentioned before, the patient of mine, when I got my diagnosis, of course, I reached out to her, and she was true to her word, and she walked with me like a mighty warrior she is, and encouraged me and helped hold my hand and help guide me on what to say and what to ask. And she suggested that I do ice hand and feet gloves and socks, and so she actually had some, so she let me use hers. So every time I would get my chemo, when they're administering the Taxotere, if you wear the iced gloves and socks, it protects your nails, it protects your hands from neuropathy. So I would go in by myself because my husband couldn't go, it was COVID, and so I would carry this giant ice bag full of ice, and I had iced overnight, and so the gloves and socks were really cold. I had 2 sets, so every 30 minutes I would swap out because it was an hour-long administer of the drug. And so, I didn't know if it was going to work or not, and I felt like an absolute lunatic. And when I asked the nurses, what they thought about it, they had no idea what I was talking about or why I was even doing it. All the patients that I was in the building with me, everybody was like, what is that? What are you doing, honey? And I'm like, I'm saving my hands and my feet. I look like a crazy person, and it's cold, but I don't care. I'm going to try it because I cannot lose my hands and my feet. And when I told this to my oncologist, he was like, well, we'll stop the treatment as soon as you get symptoms. And I'm like, if I get symptoms, then I've already got neuropathy. That already has started the damage, and I don't really think that's how we should do things. So I was trying to be as preventative as possible and to know as much as I could. And so I would go in and ask questions to the oncology nurses, and I would say, hey, so, I've given up alcohol and sugar while I'm on treatment, is that something that I should do? Fully already knowing the answer. You shouldn't drink alcohol and lower your immune and your body's ability to fight, and sugar feeds cancer. And so I was trying to eliminate a lot of the things that could contribute, but I wanted to hear what they had to say, because when I was telling the nurse that I didn't get my chemo class, she said, oh, I'll have the PA call you. And so this sweet little PA calls me, and everybody was so nice. I mean, these people were all very nice. But we're not barbecuing together. I don't need you to be nice. I just need you to do your job and take care of me and make sure that I am educated and prepared. And I wasn't. And so when she called me and she said, oh, your breast health navigator told me you have some questions about chemo. I'm happy to answer any questions. And I said, no, I just never got the chemo class. And thankfully I had friends online telling me what to ask because they had already gone through it themselves, or they worked in that department, or they've been a nurse for X amount of years. And are you getting these things? And so without my friends helping me through, I'm not sure I would have known what to say or what to ask. And so when I told her that I didn't get the chemo class, she says, oh, well, we don't do those anymore. But if you have any questions, I'm free to answer. I'm free anytime you have a question. I'm happy to answer them. And I was like, I laughed, and I was like, I have no idea what to ask you. Like, I have no idea what to expect. I have no idea what to ask you. And so I found that odd. I was like, even if you don't have time, shouldn't there be a website that kind of directs me and guides me to the education on those drugs and the side effects that I could potentially have? And, I feel like we could do better. I do feel like we could do better as educating patients and preparing them for their battle. But honestly, I thought someone was going to hold my hand and help me through, and that is 100% not what I got. And that's a heartbeat that kind of led to me doing this channel, because not knowing how to walk the battle is the scariest part. And so I want to help you be your own advocate, and you ask the questions that you should ask and know which direction to go. Kind of know because of training, but what about someone who has no training? And what about someone who doesn't even know what to ask, or, is going through blindly trusting their doctors, and which is not wrong to blindly trust your doctor. If you're the kind of person who doesn't like education and you just want to get through it and check that box, then that's fine too, because that was one of the things that I asked my surgeon's nurse when everything was said and done and I was so frustrated with my lack of information and knowledge. That is what she told me, that they don't do this sort of education anymore because some people can't handle it. And I get that. I 100% get that. That was me on my first go around, and I can relate on every step. But if we're having these things growing in our bodies from, like where my journey started when I was younger, I should have stopped then and asked, why? What is causing this, and why? What can I do about it? So, having some sort of a navigational compass to go through this battle is so, so important. And so, mine was invasive ductal carcinoma. They put me on the chemo, and so unfortunately, 80% of all breast cancer is mine. And so it's all basic center protocol, which means that they put you on the same treatment as they put me on, which means that chemo shut down your ovaries because your ovaries try to kill you because you had too much estrogen. So we have to now trap and capture all the estrogen. And so they, unfortunately shut down your ovaries. Well, because I was already having some symptoms of prolapse and endometriosis, I ultimately decided to take the reins in that department too, because I didn't want to walk around with dead ovaries inside of me because the chemo killed them. And long term, my body's going to try to fight that off. And I was under the impression that if I did the hysterectomy, then I wouldn't have to take the strongest hormone blocker going forward. And they told me that I was going to have to do it for 10 years. And, my science degree and my husband being a pharmacist, I'm not a big fan of prescriptions. I will do it if need be. Obviously, I did the chemo and radiation, but I don't want to be on something that's going to cause 10 other side effects. And so I really wrestled with this, and that was a really hard call for me, but I just didn't feel like my doctor had my best interests at heart a lot of times because, I was having all these crazy symptoms from my chemo. One of the symptoms I had, which was so bizarre, was my muscles in and around my eyes would twitch. And so it got to the point where after my first dose of chemo, it started, and I thought, well, maybe I'm just tired, allergy eye or whatever, because you did the chemo, attacks your whole body, your whole system. And so I told my doctor, and he was like, it's not from your chemo, your dose is too low. And I was like, way to diminish what I'm going through, doc, thanks. And so, cool, basic center protocol. If I heard it once, I heard it 1,000 times. And so then the second dose came in, and the eye twitching got worse. And so I told him again, hey, doc, I'm having this, whatever. And so then he would be like, not from the chemo, we'll send you to a specialist. And so after the 4th dose of chemo, the twitching in my eyes got so bad that when I would sneeze or cough or have any sort of sudden movement, the muscles behind my eyes would twitch uncontrollably like a cartoon. So I would just close my eyes and wait for the twitching to stop. And then it would take a few minutes and then it would stop. And then I was fine. And so I go to an eye specialist finally, because that took months to get in. And I say, hey, I'm a breast cancer patient. I'm going through treatments. My chemo, as I started, has progressively caused these twitchings to get worse. And he says, oh, yeah, it's common from chemo. It's the number 7 cranial facial nerve neuropathy, blah, blah, blah. Totally will go away after your chemo's done. And I was like, cool. So it's common. So can you tell my oncologist that it's common? Because he doesn't know. He sent me here to you. And so every time I had a symptom, like one day they administered my chemo and I went to the bathroom and had to urinate, and when I stood up, I peed myself after I had just emptied, and I've never done that before. And so I called my doctor immediately, and I'm like, hey, I don't know what just happened. I'm having some incontinence, and that's new. I've never had this before. And he was like, not from your chemo, your dose is too low. Go see a urologist. And so thankfully, God hand delivered me one to my chair because it was months before I could get into one. So I asked this doctor, and I'm like, hey, do you mind if I ask some questions? And he was totally cool with it, thankfully. And I said, hey, I've got this going on. And he's like, that's very common with your chemo. It causes neuropathy of your bladder. So every time I had a symptom, there was many more, but every time I had a symptom, that was the answer I got. And it was dismissive and not from your chemo, go see a specialist. Well, now I know that the oncologist can't treat those symptoms because insurance doesn't allow him to. So he can't even touch the symptoms that I'm having because insurance won't pay for it. So therefore, they have to send you out to a specialist to take care of it. And then every specialist I saw was like, it's coming from your chemo, you're fine. And so I literally felt like I was wandering around in this like cloud of uncertainty of like, what's happening? And is this going to happen forever? Or am I going to twitch like a cartoon and pee myself every time I move? Like, it was just insanity to me. And so I was like, okay, so if all of the symptoms that I have from my chemo are not documented and only sent out, then how would the person who's creating this chemo ever know that there's a connection and what symptoms they're having? Because honestly, do they know? And so I'm on the edge of, no, they don't know. So, after my treatments were done, after I finished radiation, I tried to voice my concerns and my frustrations to one of my doctors, my radiation oncologist, and I was emotional and I was mad, and so I cried. And so I told him, I'm like, I just wish you prepared me better. I just wish I knew what to expect because my radiation oncologist told me your radiation is going to be easy. You might get sleepy. It's going to be like a sunburn. Well, okay, I live in Florida. I've had many sunburns my whole life. No big deal. I can treat that with some aloe vera, whatever. And so, more than halfway through my treatments, I developed blisters and my skin is peeling off in chunks and it was super painful. And so I'm telling him, hey, I've got these sores, and I show it to him and he actually says, oh, it's not that bad. I've seen worse. And I'm like, but that doesn't mean that mine's not bad. Like, it's bad for me. And I feel like I'm pretty tough after what I've walked through. So you just made me feel crazy because I have these sores. And so thankfully my husband's a pharmacist and he got me some prescription cream that my doctor refused to write for me, which makes no sense because I have insurance. Let's take advantage of it. And so the cream that he got me worked miracles as we knew that it would. It was the Silvadine cream for burns. Cool. That should be part of protocol. Why is it not? And honestly, I think I have white coat syndrome a little bit because I don't say things mean to these doctors. I just go in and I try to be as compliant as possible because I'm a good Christian woman and I'm very kind and polite. I'm very Southern. I'm not going to go in there, like a bull in a china shop and tell you how to do things. That's not how I approach this at all, but that's kind of how I was treated, even though I wasn't doing that. So I honestly thought they hated me. And I was like, have I done something to offend them? I even asked one of the nurses, I was like, have I said something to make you guys not like me? Have I done something? And she was like, what are you talking about? And I was like, I just get the feeling that I'm just being disregarded or just tossed aside or I don't matter. And everything is diminishing the battle that I'm going through. And so anyway, I'm telling the nurse this certain day what I'm going through, and she's like, honey, you got to tell the doctor. And so the doctor walks in and I'm mid crying, oh, it sucks. And so he comes in and he's like, oh, well, Tara, what's going on with you? Are you okay? And I was like, I'm just frustrated, doc. I was like, I don't understand why nothing's being even acknowledged when I say it. I don't understand why you're not preparing patients better. And he says, well, I feel like I prepared you pretty well. And I say, doctor, no, you didn't. You didn't. I said, you told me I was going to have a sunburn-like experience, that I might be a little tired. And I pulled my chest down, which was purple and blistered. And I said, does this look like a sunburn to you? And he said, well, it's not that bad. And I said, it doesn't matter if it's bad to you. It's bad to me. And I said, this is unacceptable. And at the end of this appointment, ladies and gentlemen, you know what his only answer was for me? Tara, do you think that you might benefit from taking an antidepressant? And it took everything I had not to cuss that man out. And I looked at him and I said, no, sir. No, sir, I do not. I said, because I don't know, you don't know me outside of cancer, but outside of here, I'm a pretty joyful, happy person. I was just trying to explain to you how I felt. And, but thanks. And I never went back to him. I never went back. And I thought, okay, well, the solution would be to get a normal doctor to help me. And so I go to this internal doctor who was recommended locally, and I try to tell him, hey, I have dental anxiety. I think I've got PTSD. Not dental, that's funny. I have PTSD from like white coat syndrome, and so I'm having a hard time, and I'm really just not processing things well. I'm having all these weird symptoms still, and nobody's listening to me, and I just don't, what do you think I should do? Should I be worried about these things? And at the end of that appointment, he says to me, hey, do you think you could benefit from an antidepressant? So, no, doc, no, I don't need that. Now, because of my science training and my husband's job, I will never diminish mental illness and the fact that people do actually need these prescription drugs to function properly. There is a time and a place. I feel like I've lived in this body a long time, and I've experienced a lot of things. I think that maybe most people don't know, but I'm fully aware, and I would ask you if I thought I needed an antidepressant. But thanks anyway. So I never went back to him. And so I just kept feeling unsettled. And so I thought, I don't feel like my needs are being met. I don't think my doctor's listening to me or even likes me. So let me just get a second opinion. I had another lady who was a patient of mine, and she worked at this other facility. So I get my records transferred, and I go to the hospital that I had been getting treatment at, and I said I would like a copy of my records. And so they send, it takes hours for them to print, and it's a stack about this big. And I'm done with treatment at this point, and I'm sitting there with a highlighter, and I'm highlighting on the pages my diagnosis, because the first 5 minutes after meeting my new doctor, he says, well, Tara, when was your last MRI? And I was like, about a year and a half ago. Why? And he said, because your cancer had lobular features, and you should have been getting one every 6 months and a mammogram every 6 months after that. So a year apart for each. So because lobular likes to travel, and it's only 5% of the breast cancer. And I was so confused. And he was like, did nobody tell you that it was lobular? And I was like, no. Because if they had, I would have researched the stink out of it. So no, they didn't. And so I get my papers and my highlighter, and I'm going through, and at the top of every single one of my pages, the chart entry, invasive ductal carcinoma, stage 1B, grade 3, lobular features, invasive ductal carcinoma. Every paper, every entry. But why was that not ever said to me? So then I lost all faith in the team that had saved me. And then you start questioning everything. And so you're just like, this can't be. We're in 2023. All the modern science advances. I'm in a nice town. I mean, this is not a big town, but it's not a small town either. And I'm seeing the best doctors in this town. And you're telling me that this is the treatment that I received. And so, gosh, it made me mad. And gosh, it made me bitter. And it took me some time to heal from that anger and that bitterness. And so all along I was like, okay, God, you have given me all this knowledge, and you have given me all this information, and I don't want to just not use it. I mean, what can I do with it besides talking head videos of me just jibber jabbering all the time? People don't want to listen to me all the time. Like, I got a lot to say, but that's boring. And so I really started praying, God, like, what can I do to be a part of the solution? I just want to be part of the solution. And of course, I had to do some healing, and it was about a year and a half in. And in January this year, I became kind of more focused on my prayers. Like, God, I know you're calling me to this. I know I had this deep desire to be part of a solution. I just didn't know what it meant. And I knew, as we go through sharing things on this channel, I'm going to share health tips and tricks that I have learned, and other journeys that you could consider. And none of this is to diagnose or help treat or even discourage your treatments from your doctors, but just to inform you and to maybe start your thought process on something you haven't thought of. Or, hey, make sure you ask this to your doctor, because they're not going to hold your hand, buttercup. And so you got to suck it up and get out there and take the reins, and make sure that you know all the hard things, and make sure that you are telling your doctor of your symptoms and side effects, and make sure you're getting the treatment that you need every single step of the way. And I am fully aware that not everybody is as strong-headed as me, and you are so kind and so sweet, but this is not the time or place for kind and sweet. It's the time and place to battlefield, warrior suit up. You are a warrior, and you are entering in a field of unknown. and uncertainty. And if you're not prepared, you're going to get plowed over. And, that's not a good place to be. And so God finally put the idea of this channel of interviewing other women, other survivors, and hearing their stories of hope and encouragement, and then and putting their diagnosis in the title so that other women, when they stumble upon this channel, can hear their specific diagnosis and hear and see some other woman who has fought the fight and won, and telling her story of encouragement and hope, because your mindset is going to have 100% how you come out of it. And so all of this is connected and all of it's important. And so sharing my story helps me heal. Just doing this video is healing to me. I didn't know I was going to cry when I talked about telling my family that I had cancer, but that wound is there, and that's part of my story. So being your own advocate is kind of the theme. There is power in your story. There is power over your sickness. There is power on your journey, and there is power over pink. Everything that breast cancer stood for was pink, and I learned to hate it, but I also love it. I love the color pink, and I love what it represents. I love the research that's going into breast cancer. I love the journey that these organizations are creating for women to come together. I do love a lot of things. And I want to clarify that even though my story was pretty crazy hard, I am so thankful that I went through it, and I am so thankful to be cancer-free because of the doctors and the nurses that served me. Even though I felt a certain way, that did not diminish the fact that they did what they were called to do. And so have faith in your team. If you have a doctor that maybe you don't feel connected to, maybe try to get a second opinion to see if there's a better fit for you. I kind of wish I had done that sooner. There are lots of good doctors, amazing nurses. I've met so many wonderful people along my journey, and each of them touched me in a way that I'll never forget. Some good and some bad, and that's just part of my story. So I don't want to ever discredit what I went through and what you're going to go through, and I never want you to doubt your journey, but do your research and know what you're facing and know your options and know you're not alone. My heartbeat behind this channel, Power Over Pink, was to create a community of survivors and encouragement and hope to share with one another. And if you have questions or concerns, leave them in the comments and reach out to me, and I will put you in touch with someone I think might be better qualified than me to answer the question, or I'll answer it the best I can. But this is a community, and you are entering to the battlefield, or you've just stepped off of it. But either way, I'm glad you're here. I'm glad that you've taken the time to listen to my story. Please stay tuned. There are going to be some amazing stories from amazing warriors just like you, and listen to them and have hope and encouragement and just be amazed at the battle. And every warrior comes off with battle wounds, but that makes us stronger and better for going through it. And I am so thankful and how much I've grown, and you will too. And sometimes it's harder than we can ever imagine, but it's just something that you have to go through and get through, and there is power over it. And I don't think I ever want to diminish that you're ever done with the journey too, because you're not really ever done. If you've gone through this, the reoccurrence thought is always there. The what ifs, the unknowns, the did I do the right thing? So your mindset is going to determine how successful you are going through treatments and after. And hopefully you will be so encouraged to keep that positive mindset and to keep on fighting and to keep on pushing. So stay tuned. Like I said, there's more to come, and make sure that you check us out, like and subscribe, all that normal stuff that people talk about or don't. But anyway, I hope this has blessed you in some way, shape, or form. We'll talk soon. Take care.